So my name's Karen, and today we're going to be looking at pelvic floor exercises. And contrary to some popular opinion, this is important for men and for women. So as you get older, your pelvic muscles, your pelvic floor muscles, which are kind of like a little basket, can become weaker, and that's just natural. And that will mean sometimes that you want to go and pee more often because the bladder is sitting on top of there and it doesn't get the support it needs. Now, obviously, sometimes that's seen as a sign of cancer, and it can be one of the signs that if you are peeing more often, you're sometimes told to go and see your GP. But it could just be a sign that you have a weak pelvic floor. So it's always worth trying to do your pelvic floor exercises first. They're really simple. So all you're going to imagine is that you're going to zip up as if you're pulling up a zip, but you're pulling up a zip inside. So think about just breathing in and squeezing everything inwards and upwards, including at the back. And then let go. And you should feel you're not pulling your belly button towards your spine to increase your core strength. You're pulling up. So think about just pulling up and letting go. And you might feel the area around your pelvis gets tighter if you do this. So one more time, we're just going to pull up and then let go. Now, there are a couple of easy exercises you can do to actually activate your pelvic floor. And one of them is just a simple calf raise. This is also brilliant for your balance. Start with your feet nice and hip width apart and facing forwards. And you're just going to take a little raise. So just coming up, you can use the arms to balance. Just to begin with, nice and low, and then back down. And then as you get more comfortable, you can come a little bit higher. And back down. You could use a wall. If you had a wall, you could come and use the wall to do it. And back down. And then I'll show you side on. So we're just going to come up onto the toes and back down. And this exercise is automatically activating the pelvic floor. So you could do this one after you've been to the toilet, or when you're waiting for the kettle to boil. Just have a go, maybe 5 or 10. And just see how that goes.